Welcome to Casey Cares, Kansas City's nonprofit voice, telling the stories of Kansas City nonprofits and the people behind them. Casey Cares is proudly sponsored by the Ewing Marion Kauffman Foundation. I'm Ruth Bombigas, and we're delighted to welcome today Gianna Gargiuletti. I did okay.
Hi. That's all right.
Gargiuletti. I practiced too. Gargiuletti. Gianna, that's the most important, from Lakemary Center. A really cool organization here in Kansas City that we want to be able to let other people know about. Lakemary, where are you and what do you do?
Thank you. Yes, Lakemary, we take care of children and adults with intellectual and developmental disabilities. We have a wide range of individualized services for the folks, and work with about 625 people a year. We are our main corporate headquarters are in Paola, Kansas. That is where we started about 50 years ago from a group of the Ursuline sisters and some other family members and community members, excuse me, got together and started Lakemary, and we've expanded since that time. We also have locations in Olathe, Johnson County. So we're in Miami County and Johnson County are where our services are located. We do happen to serve in our children's program kids from across the country. There are kids with us from, at any given moment, 17 different states. So yeah, people come to us from all over, but we are in Miami County and Johnson County.
By being on the Kansas side, does that limit you with the folks that you help? Can you cross the state line? You did mention with the residential program with teens.
With our kids, yeah, we have a psychiatric residential treatment facility located in Paola, and we also have a school there, a K through 12 fully licensed school. And so residentially, we have about 65 kids living with us at any given time in our Paola campus. They're also attending our school. And then there are another roughly 35 to 40 that bus in every day from KC metro area surrounding, and those kids don't live with us, but they come back and forth to the school. So in terms of crossing state lines, I mean, Lakemary has had kids from other states for many years. Even in its beginning, the nuns were off. There's a lot of records and stuff showing that they had kids from Illinois and some other places. So it's really about being licensed in those states, as far as our school being licensed and being able to take Medicaid and those sorts of things. And our adult program is funded a little bit differently. They're funded from home and community-based waiver, and that's a Kansas-based service. So yeah, our adults that we serve here are Kansas residents.
I think your history is so interesting, and where you all started from. Can you share a little bit about that?
Yes, I think so. About 50 years ago, a little over, there were a group of parents in Paola who had children at the time with intellectual developmental disabilities, and certainly times have changed quite a bit since then. But back then, a lot of parents were told that they not to keep their kids at home, that they would be better off in someplace else, and so the Ursuline sisters, the nuns there in Paola, started with this group of folks a school for the kids, and that school opened 50 years ago. We have a couple of adults that currently live with us that were here when the school opened and when it started, which is pretty cool. And I think it was early 80s, maybe we realized that once adults graduated school, they still needed services. There was still more that needed to be done, and so we started our adult program then and expanded into Olathe. And so yeah, now we have a wide variety of services. I mean, we've got our PRTF, which stands for Psychiatric Residential Treatment Facility. That's where the kids are. We have a school. We have adult day services and residential services. We do case management for both adults and children. We have outpatient therapy programs. specialized foster care, and even business solutions where we have an e-recycling and shredding business that employs our folks and gives them money. And then we have folks working in the community on teams that go out and work different jobs. Garmin is, for example, employs a team of our folks, about 8 to 10 people, and they've been thrilled with the work we've done and want us to do more. So that's really exciting. Lakemary's really grown and expanded in a lot of ways.
I have a friend who has had a child with intellectual disabilities who worked in your shredding program, and she said it was just a godsend and really, really wonderful. How do those relationships come about? Can't be easy.
Well, we have our program, we call it Business Solutions, and we do have folks that give us jobs and work for our people to work on. And the neat thing about there are different ways that we employ folks. Some of them work out in the communities and grocery stores, or they go to Garmin on a work team, or they go to a restaurant, Olive Garden, and then we have other jobs that are brought into our locations, where the shredding and the e-recycling programs that people can drop off computers and other things that they want to recycle. And we've got a team of folks that take those apart and piece them out bit by bit, and sell for scrap what they can, and they can destroy hard drives and things like that. So that's a pretty cool thing. And people can contact us if they're interested in that, bringing that. Same with shredding. We have a lot of businesses that we do their shredding, and it's very secure. I mean, we take, whereas we are understand HIPAA guidelines and all of those things. So we want it to be a good program for folks, and that's a way, that employs a lot of people.
Can you talk a little bit more in depth on some of the programs that you have and how you get your clients, as it were?
Well, it definitely varies by program. Unfortunately, in the state of Kansas, there are a lot of people on the waiting list to get home and community-based services, to get waiver funds, and more people than the state currently has money for. So a lot of people have to wait a really long time to get into programs. And when you're a child and receiving special ed services, you can receive those services until your 21st birthday. But after that, there's not always a lot of services for folks. So we have people on waiting lists. We're generally pretty full in our adult program, and in our adult program, a lot, the folks that come and the folks that are living with us are quite possibly may live with us for the rest of their lives, until they're, we lose people, unfortunately, that we've known for a long time that pass away. And then we have folks that perhaps are, their issues are advanced and they need to be in a long-term care facility or nursing home type situation. But for the most part, we try to keep people with us. And so there's often not a whole lot of space for folks unless someone moves or passes away. In our children's program, in the residential side, it is, it's a treatment facility. So, it's not intended to be long-term, lifelong care. It's a residential treatment program. And we, kids come, they get referred a lot of different ways. Sometimes parents find us, sometimes it's other school districts. We work with, in our school, we have kids from 6 to 21, and we serve the kids in our school and residential program have to have a dual diagnosis. They have an intellectual developmental disability, oftentimes that's autism, combined with a psychiatric diagnosis, both, in order to be in our children's residential facility. So a lot of times the kids will come to us with some significant behaviors, difficulties with communication, and difficulties in the typical learning environment they've been in, or with peers. And the goal is to work with them and their families, and eventually have them leave Lakemary and go back into their own community, their own school, wherever they came from. And that can be very difficult when that's in another state. We've got kids from Alaska, we have kids from California, and several other states. And so sometimes our therapists and our case managers have to be experts in what's available in other communities when our kids leave Lakemary, and what services will be there for them. So it can get pretty complicated coordinating all of that. But because our school takes both male and female and of that age range, and with those diagnoses, we're very rare. There's only, there's maybe less than a handful of providers across the country that do exactly what we do. And that's the main reason why we have so many folks from across the country that want to place their children with us.
So for a lot of parents, it sounds like you are really a find for them in trying to bring the best services to their child.
Absolutely. I hope they feel that way. Yes.
How big's your team? You've got all these different aspects of Lakemary. So how many folks are out there helping you?
I believe we have, with our part-time and our PRN staff, around 500 people are employed at Lakemary, and I would say at least half of those, if not more, are direct care staff that work directly with their individuals. And they really are, they're the most important people, really. They have the hardest jobs, and a lot is asked of them every day, and we're very grateful for them, because without them we couldn't do what we do.
Now, you come from a background that has worked with this population. Share with us a little bit about where Gianna came from and how you got to Lakemary as the leader.
Okay, I really had not worked specifically with the IDD population before this job. I'm a licensed therapist, and I have had clients time and again that might have had a disability, but that was not my specialty before coming here. Let's see, my first big girl job, I guess, out of grad school, I was the facility director for a place called El Makers Children and Family Services, and I ran the girls facility that was in Columbus, Kansas at the time. And let's see, after that, I lived in Virginia for about 13 years, and I was the director of a sexual assault crisis center that we grew and expanded in the time I was there to also include a child advocacy center and outpatient services. I spent about 6 months in England, in Cambridge, working with some folks there and doing some work on actually with human trafficking and some research there with local law enforcement and social workers. And then I found myself headed back towards Kansas, which is my home state and place I love, and got this job at Lakemary a little over 5 years ago, and I'm very grateful to be here. I'm only the third CEO in 50-year history, so it's something I feel very honored to be a part of.
That's amazing. Quite a run for you, and hopping over the pond into England and coming back, and what an interesting kind of situation you were working in there, and you bring all of that to Lakemary and the organization itself. We can't avoid, of course, the topic of COVID. It's been so pervasive across a multitude of sectors and nonprofit. Can you share with us how you all have managed with that? You have residents, you have day folks coming to you.
Yes, this has been quite the challenge. Not something I had was very prepared for, or I don't know that anybody was very prepared for it. But yes, I think we have been very lucky so far. None of our persons served, none of our children or adults have tested positive for COVID. We've had some scares, some concerns, but no positive tests there. We've had 2 staff that tested positive in I believe early April. Both one of them hadn't been with us very long, and I think she left the healthcare industry after that, but the other person is back at work and was back fairly quickly. And we have a medical director. Her name is Dr. Shalonda Gray, and she had just started right before this business, and she's really been instrumental in keeping us as safe as possible. I think it's frustrating for folks. It's frustrating for families, but we have some pretty strict protocols in place, and we've kept them there throughout. You know, we started, I think on mid-March, I was actually away on vacation when things started, and came back early, and at that point we started following CDC guidelines and the Kansas Department of Health and Governor Kelly and Mayor Lucas, and really trying to keep our folks safe. My executive team and I started meeting twice daily. We used to meet once a week, and we implemented a lot of policies and procedures to keep folks safe early on, including we were temp checking from March, probably about March 15th or 17th, around in there. We started temp checking every staff every day when they come in, asking them a series of questions. And of course, those questions have had to change a bit as things change. I think a few weeks ago, we had to add the question of, has anybody been to the Lake of the Ozarks? But certainly, you know, asking about symptoms and who, you know, have you been around people, that sort of thing. And we're still doing that. All of our staff were wearing masks. Again, the health screenings at the beginning of the shift, constant hand washing and social distancing and that sort of thing. And we just had a real detailed plan for what might happen if any of our folks tested positive, and how we could quarantine and isolate them. And that's really been the key. We suspended all of our visits, all of our outings early on. In fact, only recently, at the beginning of June, have we started allowing visits again for folks and parents and family members to come. And, you know, they have to go through those same question and answers. And, you know, we're asking them, visits are outside, and we're asking them to wear masks and that sort of thing. You know, we ask our staff to keep themselves safe outside of work, like we all should be doing. But it, you know, it's kind of felt like we've had to give an even bigger emphasis, you know, and that reminding people that we take care of a vulnerable population, and they are all well, knock on wood. They have been well, and if any of them get sick, it's because of, you know, we've brought that into them. And so, you know, I'm asking them to keep up these practices at home, and, you know, wear the mask and social distance. And I think that, you know, that's tough. That's a lot we ask of people to do. And you know, as things are loosening up all across the state, and you know, I've gone out the last couple times I've been out, there are less and less people wearing masks and that sort of thing. And I've had a lot of people ask me, are you, you know, do you do that? You wear a mask too? I said, absolutely. You know, everywhere I go, and because I'm asking 500 people to do the same thing, and I need to as well.
Did you have unique challenges given the population that you're working with? You know, there are folks who have, you know, intellectual disabilities, so possibly and probably not able to necessarily compromise the gravity of the situation. How did you, you know, work with your population?
Absolutely. And it really varies. We have different, you know, we have different people at different functioning levels, you know, folks that are very verbal and, you know, very communicative and seem to really understand what's going on. And then we have folks that are nonverbal and don't always understand and aren't necessarily paying attention to the news. So it's definitely been a variety. There are a lot of anxieties and people upset and, you know, wanting to go places, wanting to go out. And we just, you know, we have a good crew, we have good therapists here, and just trying to educate folks. And, you know, early on when, you know, we were told, you know, only wear masks if you are sick or whatever. And then it changed to, you know, we all need to wear them. And so we had lots and lots of conversations about our kids and our adults. What if they want to wear them? And so they're just different varieties of ways they're handling things. I know some of them got some masks that they could decorate themselves. And, you know, we don't require that our individuals served wear masks, but if they want to, you know, we want them to be able to do that. Now, I think coming back into services, opening back up our day program. Now we closed our adult day program, and then our day students did not come. So those were the two programs where we were closed. And now, although our day students, about half of them ended up coming back to us through distance learning, and our teachers worked with them that way. But our school kept going. They were only closed for a short amount of time because we are, you know, our own entity in that space. And so our teachers have been back, our kids have been in summer school, and will continue. I believe our day students are coming back in the next few weeks, but yeah, all of those things make us nervous. We control what we can within the environment of Lakemary and asking people to do things, but we're also asking people to take extraordinary measures outside of work, and that's all we can do is just hope people continue, and we're very appreciative of it.
What would you see is the big lesson learned for you and the organization? We've been in this for several months. What kind of is there a best practice or things that you have learned?
Certainly communication is important, and over communicating. And I think, early on we felt a lot of pressure to get information out and quickly and that sort of thing, and not make a mistake, not say the wrong thing. But I think, yeah, that's probably been the biggest lesson learned, is just how important communication is, and really over communicating. We started doing weekly newsletters for our staff, and bi-weekly or twice a month for stakeholders. I believe our stakeholders emails are a little less. People don't necessarily want to go from getting a few emails a year to a few a month from Lakemary, but wanting to keep people informed and letting them know. And there are different situations. I mean, some parents really want to see their family members, and vice versa, and that's been a tough situation to say, we understand where you're coming from, but it's really our job to keep them safe, and that's what we're trying to do. And please be patient. And for the most part, people have been.
Is there a role for volunteers with the organization?
Absolutely. There are lots of opportunities with Lakemary. We have a volunteer coordinator, and people can get in contact with. His name is Dee. If they're interested, we have volunteers that come in and work with our folks. We have people that volunteer at fundraising events, and just lots of different opportunities.
And the best way is through the website?
Probably, yes. I think on our website is the best way, or certainly calling our main phone number, which is 557-4000. 913, and can speak to people there. Also, just thinking about us if you own businesses or can employ folks, keeping us in mind. Our folks they're good employees. They're on time, and they care about their jobs, and they generally have a ride, and weather doesn't stop them from getting there. And people are just really very pleased when they hire our folks.
And we want to make sure the website is www.lakemary.org.
Correct.
And that'll get to whatever campus or wherever in your system.
Yes, that will get wherever you need to go, lakemary.org. And Lakemary is one word. Oddly enough, it's one word.
What's the most fulfilling about leading this organization for you?
Oh my gosh. I mean, I always hate it when people ask me this question, because it
I'm sorry.
Makes me, it always makes me a little bit tearful, really. I feel very lucky and very privileged to do what I do, and to be in an organization that, takes care of people every day and makes people's lives better. And it's an amazing thing, and the folks that, everybody that works at Lakemary, but particularly the people that do direct care, those are not high paying jobs, and they should be, but unfortunately they're not, and we're asking people to come to work every day, and, some don't make as much as they can make at some fast food places, and, some retail stores are paying $15 an hour, and we're trying very hard to get our folks up to that level of pay. But to see people come in every day, and I meet with everybody after they've worked at Lakemary for 90 days, and just have kind of a brief check-in. Hi, how's it going? And nice to meet you. And unfortunately, I can't remember 500 names, but I could try. And, when I talk to those folks, that I really enjoy them. I ask them the same question, what do you like about this job, or what keeps you coming back? And it's just incredible to me, the things they say. They're little things, just maybe a kid or an adult, made it through the night without wetting the bed, or somebody, was very unhappy yesterday and today is allowing a person to read them a story. Or, I mean, it's these little tiny things that make them happy and keep them coming back to work every day. Just seeing kids get better, seeing, we've got a person with us right now, a child who hadn't spoken ever, and they're about 11 years old, and recently has learning some sign language and has said some words and things like that. And I mean, those are the kind of things that make people feel good and make them keep coming back to work. And I feel very privileged to be a part of an organization like that, and have so many people that are so committed working with me at Lakemary. It's awesome. And it's just a great organization. Lots of people, lots of longevity. You really get, these are kind of jobs that you get, you fall in love there, and you get hooked.
Well, they're very lucky to have you at the helm and doing the incredible work for a population that I think sometimes is, in the shadows or pushed aside. So again, it's Lakemary Center. Check out the website, find ways that you can help, support, learn more about such a critical organization. We're so glad you joined us.
Thank you, Ruth. I really appreciate this opportunity. Thank you so much.